Well, researchers in Hong Kong say a 33-year-old man has been reinfected with coronavirus for the second time. The New York Times reported the story, which is now raising big questions about immunity. NBC7's Priya Sridhar has more.
While there have been several reports of people getting reinfected with the coronavirus, like the sailors on the Roosevelt, this is the first time medical professionals have done rigorous testing to find a live virus and not just viral fragments left over from the first infection. Michael Weiss spent almost 2 weeks in the hospital and 10 days on a ventilator back in April when he tested positive for COVID-19. In total, 7 of his family members tested positive and 2 passed away, including his mother. He says when he saw the reports of sailors on the Roosevelt potentially being reinfected, he knew he had to stay vigilant.
Even though people were saying that you could possibly have the antibodies and not ever get it again, I didn't treat it as such. My family and my wife and I, we do our social distancing. We wash our hands frequently. We always wear a mask when we go out in public.
Now, researchers in Hong Kong say a 33-year-old man has been reinfected with the coronavirus and is showing no symptoms. Epidemiologists now say this could prove that the virus is mutating. It also could suggest patients who don't get a severe form of the coronavirus the first time aren't developing enough antibodies to develop permanent immunity from it.
What's discouraging is, of course, that this patient could be infectious and could be transmitting the virus to other people after assuming that he was basically done with the infection.
Medical experts say this new case shows how important it is to practice social distancing and wearing a facial covering. Even if you've already tested positive, there's a chance that you're asymptomatic and could infect others without even knowing it. Priya Sridhar, NBC7.
Researchers believe that the 33-year-old man was infected with a different form of the virus than his first infection. Other similar viruses, including SARS and MERS, produced protection for people who had been infected for a few years.